Welcome back to This is VANCOLOUR. So, British Columbia is now sending cancer patients to receive radiation treatment in Bellingham, the Washington state city with a population of 92,000 people. And for reference, Greater Vancouver's population is more than 25 times that at 2.5 million people. So, great that folks will get the urgent treatment that they need, but what does that say about how we've maintained our own healthcare system? Here to discuss is my friend, a cancer survivor herself, the president of Down Syndrome BC, the host of the TELUS Talks podcast, local broadcasting legend. She is, of course, Tamara Taggart, and this is Tea Time with Tamara. Hi, Tamara.
Hi.
So we're going to do this again? We're going to try to get in trouble again.
No way. No way. I just speak the truth.
You absolutely do. Of course, when this news broke that BC is now going to send cancer patients to Bellingham for radiation treatment, I thought of you immediately. You are a cancer survivor yourself. What's your reaction to this news?
Well, I got to say that when I first heard that there was a press conference happening, I thought it was good news. I thought it would be the announcement of some new equipment or a new treatment center or something. So when I did tune into the press conference, and it felt like someone punched me in the stomach. I could not believe that we are sending, cancer patients, breast cancer and prostate cancer, to Bellingham for radiation treatment.
But if you were one of those patients, isn't it good news? Because now at least you get the treatment that you need?
Yeah, I guess it depends how you look at it, right? Yes, It's great news that you're getting treatment. Having cancer and getting in your car or plane or whatever you have to do, waiting at the border, going to a different town, that to have your treatment and staying there for your treatment is a complete and utter failure on our government's part.
Yeah.
It is an absolute failure. It is the worst case scenario. It really, truly is. I mean, we, as citizens, we have raised hundreds of millions of dollars for BC Cancer. All of us. If all of us have been touched by cancer in some way, shape, or form. And so, we count on the government to be good stewards of the money that we have raised for the best research, the best treatment, the best equipment. These are things that we have raised money for because we've lost someone to cancer. This is why we do the Run for the Cure. This is why we do the tour, the bike ride to conquer cancer,
Right.
All of it. And this is how we're paid back by the government screwing up so bad, not having the proper management. And I'll blame the health minister 100%. It falls on him 100%. Also, Stephen Brown, the deputy health minister, 100% falls on him. And the PHSA, this is mismanagement. This is bureaucracy at its finest screwing up.
Isn't it mismanagement over several years? We're not talking about something that necessarily...
Oh, over 7 years?
No, several years.
7 years? That's the other thing.
I'm just saying, I don't know what the timeline is, but it's not something that happened overnight and certainly will not require, or it can't have an overnight fix either, right?
So, right. And that's poor management. If you are a manager, and let's be clear, Adrian Dix has been our Minister of Health for 7 years. Stephen Brown has been the Deputy Health Minister in Health for a lifetime, it seems. So long, it's ridiculous. The PHSA, if you cannot manage this and look into the future and know what cancer is going to look like in our province, you should not be in that job 100%. Yeah. And the other thing that makes me so mad is when, Adrian Dix will never have to wait for cancer treatment. Stephen Brown will never have to wait for cancer treatment. Anyone working in government at the Ledge right now will never have to wait for cancer treatment. And you know what? Either will their friends and either will their family, because they have privilege. They do not know what it's like. They'll never have to go to Bellingham for radiation. They will never know what it's like to be told you have cancer. Oh, by the way, we're going to send you to Bellingham for your treatment.
I guess where I'm very concerned, and I like this announcement, at least people who need the treatment or getting their treatment.
100%.
However, I'm really concerned about all stages of the cancer treatment cycle, whether it is testing and screening, whether it is treatment for people outside of prostate cancer and breast cancer. Where do they stay? Because it's not just one bottleneck. So my big question for the government is, okay, well, what about these other stages? What are we doing to ease the backlog that we know exists
What
now?
happens when we don't have people to administer the chemo?
Right.
Where do we send those people? Like, I hope they're looking at that. And I want to say too, I do not think this is BC Cancer's fault at all. I think BC Cancer is doing the best that they can under the thumb of the PHSA and the government of British Columbia.
Does this ultimately come down to a human capital issue where we don't have enough doctors or nurses on the ground?
100%.
Yeah.
And who's responsible for that?
Well, the profits.
Yeah. I mean, they are to blame for this.
Yeah.
And it's like when you have a press conference to tell people that we are now sending cancer patients to Bellingham and you expect everybody to be happy about it. I mean, you're delusional, first of all. Second of all, when you don't answer any of the reporters' questions as the Minister of Health, he didn't answer anyone's questions. He rambled off a bunch of numbers that were wrong. Like there have been articles on how wrong he was on numbers. I mean, it's just so disrespectful to every single person in this province because we are all going to get cancer eventually. If we live long enough, we will eventually get cancer.
Now, whether it is cancer care or the crisis and emergency rooms that we also have all across the province, especially in Surrey, is this one of those things where these failures in our healthcare system will open up the gateway to privatize medicine for better or worse? Because people are going to say, we have to try something else.
Well, how do you explain this to me? Like, Adrian Dix does not want private healthcare. Lots of people don't want private. We do have private healthcare in this province. I mean, I have to pay to go to the podiatrist. I have to pay to go to the eye doctor. I mean, I don't know. Like, I'm paying them. So that seems like it's private, doesn't it? If I'm paying
some aspects of it are private,
it's weird. Yeah. I'm paying to get my teeth done.
Yeah.
Like, that's healthcare, isn't it? My dental work. But the thing is it's like we're sending cancer patients to a private clinic in Bellingham.
Right.
It's a private for-profit clinic in Bellingham. It's not a public hospital. We're not paying the state of Washington. It's a private clinic.
Yeah.
So none of this makes sense to me. Like if, when we watch, it all makes me so mad because we are talking about cancer. It is the most horrible disease. It is a horrific disease. What it does to you, what it does to your body, what it does to your mind, what it does to everybody around you, what it does to your spirit, what it does to everything. And then to be sent to another country for your treatment is beyond my comprehension. Yes, I'm glad those people are going to get treatment. But boy, oh boy, I feel horrible for them that they have to travel away from their home, away from their loved ones to go get this treatment. It's awful.
Well, I know that this is a discourse that is not going to end anytime soon. And I know that you're a very strong advocate and a strong voice on these type of healthcare issues. So Tamara, thank you for your time and thank you for your passion in this arena.
Oh, well, somebody has to be loud and mad about it.
Thank you so much. Folks, that's our show. Certainly a legendary pairing of guests. Thank you to Tamara Taggart and Kirk McLean for their time tonight. And of course, if you want more, find This is VANCOLOUR on Apple Podcasts, Spotify, CHEK Media's YouTube channel, and the CHEK Plus app. For now, though, this is VANCOLOUR, and I'm Mo Amir telling you that in a province where you can be anything, be colorful. Peace.